Hi, I'm Dr. Rob Myers. This is Cardio Talks. I'm a cardiologist at Sunnybrook Hospital in Toronto. The goal of these videos is to explain common cardiac conditions in a way that is super easy to understand, answer your questions about what it is you have. With atrial fibrillation, it's a complicated rhythm problem. It takes a bunch of videos to understand it. So atrial fibrillation, which I've mentioned before, is an irregularly irregular rhythm. It is detected on an electrocardiogram. Now, even though an electrocardiogram or ECG or EKG was invented in 1908 by Einthoven, he won a Nobel Prize in 1924, so that's how important this is. It's still a test we use, and it's a test that tells us exactly what your heart rhythm problem is. Now, usually, as we've discussed previously, the electrical impulse begins in the top chamber of the heart. And when the top chamber, the atria, contracts, you get a little bump on the electrocardiogram. It's called a P wave. So the ECG is detecting what that is. And then the main pumping chamber forms a much taller spike. It's called a QRS. And so that would be a normal pattern of electrical activation. To understand an ECG or EKG, because it just looks like a bunch of spikes to most people, it's like having a circular glass house, stuff's going on inside the house, making dinner, watching TV, doesn't really matter, and you station 12 people around the house, all equidistant, and they all see the same stuff going on, but they report it from a different perspective. That's what an EKG is. It's got 12 leads looking at the same thing, just from a different angle. Now, with atrial fibrillation, because the top chamber does this, it doesn't really contract in an organized way. You don't have any of those P waves at all. It's just this irregular looking line. And the main contraction of the heart itself, though, is perfectly normal. That's the QRS. So you still see that. Tends to be you see more of them on the electrocardiogram, and they're irregularly spaced. So instead of, it's more like, and that's the hallmark of what the EKG or ECG looks like. What are the symptoms of atrial fibrillation? Common question. Patients will often ask, what symptoms should I get? And I get that question, I understand it, but it's not very helpful because the answer is, if you have the symptom, that's your symptom. It's anything. If you're not troubled by your symptom, you're not troubled by it. So it's sort of logical that with symptoms in general, it's really what you're reporting to me. So symptoms of atrial fibrillation run a very wide gamut from zero. For example, somebody might have a yearly visit with their doctor. They're feeling great. Doctor checks the pulse, does an EKG, and says, hey, you have atrial fibrillation. Patient's like, I don't know what you're talking about. I feel perfectly well. You can still be referred to me, or you should be, frankly. And so that's one end of the spectrum. The other end of the spectrum, you're sitting there minding your own business, maybe a glass of wine, maybe not, and your heart starts to pound rapidly. You're anxious. You're lightheaded, you're short of breath, you might be feeling tired, what's going on? You call an ambulance. Pretty wide range, but most people are somewhere in between. Palpitations is a symptom. Palpitations means I can feel my heart beating. It could be a single brief skip or flutter that might startle you or make you cough, or it can be fast, irregular, you get lightheaded, you could lose consciousness. All of these things are still palpitations. So the first question I'll always ask patient is, do you feel your heart beating? And then we'll explore how often, what does it feel like, how long does it last, and are there other symptoms? Some people don't really get palpitations, they just feel off. They know something's unusual, but they're not really able to articulate exactly what the symptom is. Other people feel jittery or jumpy or anxious, so these are non-specific. Patients can be breathless when they walk. That may be the only symptom. It's a really important symptom, but it's one of the least specific things you could possibly tell me. Being breathless when you're walking can be due to anything. So someone who notices a decline in their ability to exercise may have atrial fibrillation, but that's one of about 10,000 things they can have. Getting really tired easily. So people will say, I tire easily. Sometimes that's code for I'm getting breathless. Lightheadedness can occur, but not just standing up. That's called postural lightheadedness. If you stand up quickly and you have lightheadedness for a few seconds, don't stand up quickly. Rarely it can result in loss of consciousness, and I recently saw a professional athlete who had loss of consciousness with their atrial fibrillation, but that isn't very common. It doesn't tend to be associated with chest pain or pressure. Now, a heart attack can be associated with atrial fibrillation, but not just I'm feeling my heart skipping. You would usually have other symptoms of a heart attack. And so with these symptoms, you're going to seek medical attention. You're either going to go to the doctor electively, you're going to see your family doctor, feel unwell. he or she will detect something and send you to me, or you'll go to the emergency department, as I said, which is a completely different kettle of fish. So with our next discussion, we're going to go through the management of atrial fibrillation, and it's going to be divided into how it gets managed in an emergency department. That should help you move forward, and how it gets managed when you come to me as an outpatient. I hope that helps.